So what is cardiovascular system? The cardiovascular system is what keeps us and our organs alive. It consists of the heart, blood vessels, and blood. Let's first start off with the heart. The heart is the most important part of the system because it pumps blood throughout the whole body. Without it, we'll basically die. Next, blood vessels. It consists of arteries, which carries blood away from the heart, veins that carry blood back to the heart, and capillaries that permit diffusion between blood and interstitial fluid. Blood is the last structure and it composes of red blood cells, white blood cells, and plasma. Their main functions are to transport gas, nutrients, hormones, and metabolic waste, to regulate pH and ions, to restrict blood loss, and this is by a process called clotting, protect against toxins and pathogens, and this is the main role of white blood cells, and to stabilize body temperature. The first disease that affects the cardiovascular system is endocarditis. It is commonly referred to as bacterial endocarditis. There are two types, one being infective and the other non-infective. You may be wondering, what is non-infective endocarditis? Well, it is a name given when endocarditis isn't caused by bacteria or fungi, for example, those who have autoimmune disease like lupus. The term also changes depending on how severe the disease is. There is acute, subacute, and chronic. It's acute when the disease develops suddenly and may become life-threatening within days. Subacute or chronic is when it develops slowly over a period of weeks to several months. Now the big question, how does it occur? It occurs by bacteria or fungi entering the mouth, intestine, respiratory tract, or urinary tract. The bacteria or fungi goes into the bloodstream and infects the heart valves. The right side is the less common, and it accounts for only 5 to 10% of cases. The tricuspid is the most valve is the most common area. The bacteria sticks to any damaged or healing valves and eventually leads to a huge amount of bacteria buildup. This is very dangerous because it ruins the heart pumping action, which causes the heart not to supply blood to the body. And you can get these bacteria or fungi by having poor oral hygiene, implants, skin disorders, or other infections. The few types of bacteria and fungi that could enter your bloodstreams are Streptococci, Staphylococci, Coxella burnetii, Actin bacillus, and Trophirima whipple. The strep and staph accounts for only 80% of cases. Endocarditis can cause heart failure and abnormal heart rhythm. This is due to the amount of bacterial buildup in the valves, which make the heart not pump correctly. This is the reason why we get abnormal heart rhythm, and the heart is providing less oxygen to the body, which leads to the heart failure. It can also cause sepsis, bacteremia, and blood clots. Sepsis will be called septicemia due to the pathogens being present in the blood. Bacteremia is bacteria circulating in the blood. Blood clots occur when the bacteria build up in the valves, break off, and clogs an artery, which can lead to stroke. A few symptoms are fatigue, fever, weight loss, heart murmurs, red spots on the skin, aches, and pain. The fever is due to our body trying to fight off the disease. Fatigue, weight loss, and spots on the skin known as petechia are common symptoms due to the low oxygen throughout our body. The list of symptoms increase or change slightly depending on the severity of one's endocarditis. If you have acute endocarditis, the symptoms will be a fever of 102 through 104 Fahrenheit, chills, fast heart rate, fatigue, night sweats, aching joints and muscles, persistent coughs, or swelling in the feet, legs, or abdomen. If you have chronic endocarditis, the symptoms will be a mild fever of 99 through 101 Fahrenheit, fatigue, a moderate fast heart rate, weight loss, sweating, and anemia. To diagnose endocarditis, doctors will take a sample of your blood and use it for a blood test and blood culture. The blood test is to check for physical and biochemical properties, and the blood culture is to determine evidence of blood infection. The most common diagnosis is an echocardiogram, which is a machine that shows an ultrasound of the heart. With the echocardiogram, we can see the damages in the valves and the bacteria buildup that is stuck on the valves. Endocarditis treatment are antibiotics, antifungal, blood thinners, and surgery. The two main types of antibiotic given are prophylaxis and vancomycin. Prophylaxis is normally given to certain dental procedures to reduce the risk of developing endocarditis or for those who have heart valve disease that are getting implants, heart valve repairs, heart transplants, or those who have already had endocarditis before. Treatment lengths vary depending on the type and cause of endocarditis. 40 through 50% of patients who are infected get surgery. The recovery time is approximately 6 through 8 weeks. To prevent endocarditis, maintain good oral hygiene, treat your wounds, and take your antibiotics or antifungals that was given by your health provider correctly.
Disease number two affecting the cardiovascular system is myo- myocarditis, also known as inflammatory cardiomyopathy. There are three main types: acute, chronic, and lymphocytic. Acute cases have a relatively fast onset, usually caused by a virus, can develop suddenly, and symptoms resolve rapidly as well. Chronic cases usually take longer to treat or when symptoms reappear after experiencing the conditions, caused by inflammatory conditions such as autoimmune disorders. Lymphocytic cases are rare and can lead to hospitalization. Occurs when white blood cells enter and cause inflammation of the heart muscles. Conditions occur after a virus. Myocarditis is caused by infections, some drugs and chemicals, or conditions that cause body wide inflammation. Often the cause is not found. Myocarditis is dangerous because it weakens the heart so the rest of the body doesn't get enough blood. Blood clots in the heart can cause heart attack and stroke. Worldwide, myocarditis is most commonly caused by Chagas disease from the protozoan Trypanosoma cruzi. Causes and risk factors include COVID-19, the vaccine, or the disease. Coronavirus can infect heart muscle cells, causing inflammation and damage. Retroviruses such as HIV, rheumatoid arthritis, transplant rejection, and exercising while infected. Risk factors include dizziness and fatigue, abnormal heart rhythm, murmurs or palpitations, shortness of breath, swelling in the upper or lower extremities, heart failure if left untreated and is severe. The people most at risk are young men. Men are 9 times more likely to get myocarditis than women. People with diabetes or weakened immune systems. Myocarditis accounts for 10 to 20% of sudden death in young athletes. Symptoms include chest pain, fatigue, swelling of legs, ankles, and feet, shortness of breath at rest or during activity, feeling like you're going to faint, flu like symptoms, and sometimes symptoms are similar to that of a heart attack. Signs of infection include diarrhea, headache, fever, muscle aches, and sore throat. Symptoms of acute myocarditis include heart failure while at rest, develops over hours or days. Treatments include medications and mechanical devices to improve heart function. Symptoms of non-acute myocarditis include less distinct onsets, develop over days to months. Symptoms may overlap those of acute myocarditis, but typically do not require mechanical devices for circulatory support. Myocarditis diagnoses include blood tests. Cell damage can be represented by elevated troponin levels. Chest x-rays can see the size and shape of the heart and see signs of heart failure. Heart MRIs can see detailed images of the heart's size, shape, and structure, will also show signs of heart muscle inflammation. Cardiac catheterization and heart muscle biopsies. The dye injected through catheters can make arteries appear better in chest x rays, and tiny biopsies samples of the heart muscle can be tested for inflammation or infection. Myocarditis treatments include ACE inhibitors, which lower blood pressure and help with remodeling of heart muscles. Length of treatment depends on type and case. Some may take medications for a few months and recover completely. Others may have long term permanent heart damage and need lifelong medications. Preventions include avoid close contact with those who are sick, washing hands regularly, avoid risky behaviors such as unsafe sex and illegal drugs. Um, Also, getting recommended vaccines that cause myocarditis, such as COVID-19, influenza, and rubella. COVID-19 vaccines rarely cause myocarditis. Also, lifestyle changes, which usually involves lower salt intake, dieting, and fluid restriction.
The third disease that affects the cardiovascular system is pericarditis. It's also known as Dressler syndrome. Pericarditis occurs as an immune response to a heart injury or surgery. It is swelling and irritation of the thin tissue surrounding the heart. There are 4 different types of pericarditis. Acute pericarditis begins suddenly but doesn't last longer than 3 weeks. Recurrent pericarditis occurs about 4 to 6 weeks after an episode of acute pericarditis with no symptoms in between. Incessant pericarditis lasts about 4 to 6 weeks. Chronic constrictive pericarditis usually develops slowly and lasts longer than 3 months. The areas of the body that are affected by this disease cause chest pain, outside layer of heart tissue, and the heart. Some causes of pericarditis include immune system response to heart damage or after a heart attack, also known as post-myocardial infarction syndrome. COVID-19 also played a large role in the rate at which patients were getting sick with pericarditis. Inflammatory disorders such as lupus and rheumatoid arthritis, and kidney failure and cancer. There are many symptoms that may lead to or be caused by pericarditis. However, these are the most common: a simple cough, fatigue, weakness or severe cold, certain body parts swelling, such as the abdomen and the legs, a fever, high heart rate, problems breathing, and chest pains. The way you can diagnose pericarditis is using an electrocardiogram, which is a quick and painless test that records electrical signals in the heart, a chest x-ray, which can show changes of the heart in size and shape, an echocardiogram, which uses sound waves to create images of the moving heart, cardiac computerized tomography, or a CT scan. It uses x-rays to create images of the heart and chest, or cardiac magnetic resonance imaging (MRI). It uses magnetic field and radio waves to create cross-sectional images of the heart. Pericarditis is often treated by taking medication. Pain relievers reduce inflammation and swelling around the heart. Corticosteroids are also a form of medication used to fight the inflammation. Surgeries include pericardiocentesis, which uses a sterile needle or small tube, also known as a catheter, to remove and drain the excess fluid from the pericardial cavity. Removal of the pericardium, pericardectomy, may need to be removed if the surrounding sac of the heart is permanently rigid due to the constructive pericarditis. Although there are really no preventions for pericarditis, you can take steps such as getting recommended vaccines, following good hygiene, and avoid people who have viral, flu-like illnesses.
The next disease, coronary artery disease, simply abbreviated as CAD, or also known as atherosclerotic heart disease. Its stages are defined as normal, mild, or severe. Currently, there is an issue of a lack of a staging system that makes it reliable to measure and treat heart disease. How it occurs is buildup of the plaque in the walls of the major arteries, and another thing of note is it's made up of cholesterol deposits. The main areas that are affected are the major arteries of the heart, which include the left and right major coronary arteries. Causes include being overweight, physical inactivity, unhealthy eating, smoking tobacco, atherosclerosis, high cholesterol, diabetes, and hypertension, which are all also causes of coronary artery disease. Having a family history of CAD includes your chances of getting it by age 50.
Coronary artery disease symptoms. In some cases, there are no symptoms at all, but most commonly there is pain in the chest and can cause indigestions or sweating. The whole body can experience fast heart rate or shortness of breath, which is the most common symptoms for CAD. Symptoms only start to occur when the heart is only getting small amounts of oxygen instead of what it's used to. When this happens, normally there is quite a lot of buildup in the arteries. Coronary artery disease diagnosis. To diagnose CAD, your doctor will use a multitude of different tests measuring electrical activity one alongside with regularity of the heartbeat. Creating an ultrasound of the heart is to see what's going on around the heart alongside the arteries as well. The main diagnosis for CAD is a coronary angiography, which is minimally invasive. Also known as a cardiac catheterization, it uses a special dye to contrast the material around the artery, allows the x-ray to see how blood flows. Coronary artery disease treatment and prevention. Prevention. One of the easier ways of prevention for CAD is to exercise daily, cut back on fatty foods with high cholesterol, saturated fats, and trans fats. Switching out a certain oil for healthier options such as coconut oil or olive oil is beneficial. Treatment. Cholesterol drugs and medications that reduce cholesterol and plaque buildup in the arteries. Beta blockers and calcium channels are also prescribed to patients for CAD. Coronary angioplasty is a treatment used alongside surgery in severe cases.